Welcome to the Deep Dive, your shortcut to being truly well-informed. Today, we're plunging into a topic that's, well, fascinating, but also quite serious. Atresia Ani. It's a congenital defect, meaning present from birth. And what I find really compelling is how this same condition can present such, wildly different challenges.
Absolutely, depending on the animal.
Exactly, depending on the animal involved.
Right.
So we're going to try and unravel this, looking specifically at two distinct groups. First, camelidae, that's your llamas and alpacas.
Right.
And then cervidae, which includes deer and elk. We'll unpack what Atresia Ani actually is, how it's diagnosed, how it's managed.
And crucially, why those differences exist across species, why it matters so much.
Right.
And that really hits on why this topic is so important. It's obviously a profound challenge for the little ones affected, the neonates.
Of course.
But it also gives us this really compelling real-world window into the practicalities and even the ethical side of veterinary medicine.
That's a great point.
Yeah, it's, an insight into how context, the species, the environment, fundamentally shifts the approach to care. And that's valuable for anyone interested in animal health.
Definitely. Okay, so before we get into the species specific, let's lay the groundwork. Fundamentally, what exactly is Atresia Ani?
At its core, Atresia Ani is a congenital defect where you have either a complete absence or maybe an abnormal development of the anus.
Okay.
So essentially, the animal just cannot defecate.
Right, a basic function blocked.
Exactly. And that's critical because if it's not corrected surgically, it inevitably leads to some really severe gastrointestinal problems. And sadly, it's ultimately fatal.
Wow. And how does this happen? Developmentally?
It traces back to embryonic development. There's a membrane that's supposed to separate the hindgut internally from the skin externally. And in these cases, that membrane fails to rupture as it should during development.
I see. So it's not always just a simple no anus. I think I read there are actually different types.
That's right. It's not quite that simple, and understanding the classification really is key. It complicates things, but it also helps guide treatment.
Okay.
Veterinary medicine generally classifies Atresia Ani into 4 types, and they increase in severity.
All right, let's break those down.
Okay, so type I is called anal stenosis. Here, the anus is present, but it's abnormally narrow. Often there's a thin membrane still partially covering the opening, but the underlying structures are mostly okay.
So restricted, but there's an opening of sorts.
Yes, exactly.
Yeah.
Then type 2 is an imperforate anus.
Huh?
This is where a membrane completely covers the opening, but the good news, relatively speaking, is that the rectum itself ends in a blind pouch pretty close to the skin surface. This is actually the type we see most often.
Okay. Still requires fixing, but maybe more accessible.
Potentially, yes. Then we get to type 3. This is also an imperforate anus, so no opening. But here, the rectum ends in its blind pouch, much deeper inside the body, more cranially, further away from where the anus should be. The opening is just absent.
That sounds more complicated to repair.
It generally is. And finally, type 4. This one's rare, thankfully, and often the most challenging. There are a couple of variations here. Either the rectum and colon are completely separated, no connection to the anus or skin at all. Or, interestingly, the anus and the very end of the rectum might look normal, but a whole section of the rectum just further up is missing. It's absent.
Wow. Okay, those distinctions really paint a clearer picture of the potential challenges. So, with that understanding, let's zoom in on our first group, the camelids, llamas, and alpacas. You hear that congenital abnormalities in general are reported more often in these guys, right?
That's correct. They seem to have a higher incidence of various congenital issues compared to some other livestock.
And Atresia Ani is considered one of the more common and potentially lethal defects affecting their newborns, the crias.
It is, and for a cria born with this, the signs become pretty obvious, usually within just a few days.
What should someone look for?
Well, first, a physical exam will show the complete lack of an anal opening. That's the most direct sign. Then, as the meconium, that's the first feces, and subsequent feces start to build up because they can't get out, you'll see progressive abdominal distension, the belly gets bigger and harder, and there's clear pain.
Poor things.
Yeah. The criandae will often strain, trying to defecate. That's called tenesmus. They'll lose their appetite, become lethargic. And sometimes you can even see a visible bulge right there in the perineal area where the anus ought to be.
So diagnosis sounds pretty straightforward then, based on those signs.
It typically is, yes. History and the physical exam are usually enough. Radiographs, like X-rays, are often helpful, though. They confirm how bad the fecal impaction is. And, importantly for surgery, they show exactly where that blind rectal pouch ends.
Oh, okay. For planning the repair.
Precisely. And one other crucial thing with camelids, always check thoroughly for other congenital problems. Unfortunately, it's quite common for crias with Atresia Ani to have other defects too.
Right, that complicates the picture even more. Given how essential defecation is, I imagine time is really of the essence here. What's the prognosis without intervention?
You're absolutely right about the time factor. Without intervention, it's invariably fatal.
Always.
Always.
Yeah.
Usually within a matter of days. The buildup of toxins, the pressure, the inability to absorb nutrients properly, it leads to sepsis or rupture.
So surgery is the only way.
It's the only viable treatment. Prompt surgical correction is essential.
What does that involve briefly?
The procedure is generally called an enoplasty or sometimes a rectal pull-through. Basically, the surgeon makes an incision where the anus should be, carefully dissects down through the tissues to find that blind end of the rectum. Then they open up that rectal pouch and suture the lining, the mucosa, to the skin edges, creating a new functional opening.
And aftercare.
Post-op care is really important, usually involves antibiotics to prevent infection and very careful cleaning and management of the surgical site.
And the outlook for these criases,
Yeah.
if they get the surgery.
The good news, particularly for camelids, is that if it's diagnosed early and the surgery goes well, especially for those type I or type 2 cases we talked about, the prognosis is generally quite good. They can go on to live normal lives, but it really is a race against time.
That's encouraging, at least for the camelids. Okay, so now let's shift gears. What about our cervids? The deer and elk. You mentioned things are quite different here.
They really are. It's a stark contrast.
Also,
Well, the most striking thing is the prevalence, or rather the lack of it. Atresia Ani appears to be extremely rare in cervids, or perhaps significantly underreported. It's hard to be certain which.
really, compared to llamas and alpacas.
Oh, very much so. The veterinary literature, the documented cases, it's incredibly sparse for deer and elk, especially when you compare it not just to camelids, but even to other ruminants like cattle or sheep, where it's a known, though not common, issue.
Why do you think that is? The difference?
That's the million-dollar question, isn't it? It could be genetics. Maybe they just don't carry the trait as often. It could be survival pressures in the wild. Maybe affected fawns simply don't survive long enough to ever be found or documented.
Ah, right. Natural selection working very quickly.
Possibly. Or it could just be the inherent difficulty of finding and studying congenital defects in wild populations compared to farmed animals. The most solid evidence we really have is actually from a single case report, a Sika deer in Taiwan.
Just one.
One well-documented case where they successfully treated Atresia Ani, and this deer even had a concurrent rectovaginal fistula, which is another complication.
Wow. So if it occurs, say, in a farmed deer or elk, the signs would be the same.
Yes, exactly. If you had a fawn or an elk calf in a farmed situation, you'd expect to see the same things. Failure to pass meconium, that swelling abdomen, straining, lethargy.
Diagnosis would be similar. Physical exam.
Physical exam would be the key, yes. Looking for that absent opening.
But the management. That's where things really diverge, I gather.
Hugely. The management challenges are significant, and they depend heavily on the context.
Okay, walk us through that. Wild versus farmed.
Right. So in wild populations, it's simple, sadly. It's invariably fatal. A fawn or calf that can't defecate out in the wild. It weakens very quickly. It becomes easy prey, or it succumbs to sepsis. There's just no practical way to intervene.
Makes sense. And in farmed populations, where intervention is at least conceivable.
Technically, surgical correction is possible. That Taiwan case proves it can be done.
But if-
But euthanasia is often the recommended course of action.
Why? If surgery is possible.
It comes down to the complexities and the resources required. We're talking about major surgery on a large animal that might not be fully domesticated. The procedure itself is challenging, and the postoperative care. Managing the wound, giving medications, preventing infection, managing pain. It's incredibly intensive and difficult in these animals.
I can see that. Much harder than Atresia.
Much harder. So the decision often comes down to the specific value of the animal, the facilities and expertise available, and the nature of the defect. Is it a simpler type 2 or a more complex type 3 or 4?
So the prognosis reflects that difficulty.
Absolutely. Prognosis is highly variable. You could say guarded at best in farmed cervids, really depending on all those factors. And as we said, tragically, it's effectively zero or fatal in the wild.
Okay, so let's bring this all together then. If we compare the two groups side by side, What are the main takeaways for someone trying to understand this?
Yeah, summarizing the key comparative points really highlights the differences. First, you have prevalence. It's recognized, relatively common in camelids, extremely rare, or at least very underreported in cervids.
Okay, big difference there.
Huge. Second, clinical signs and diagnosis. These are actually quite similar across the board. You're looking for that absent anus, the belly swelling, the straining. Diagnosis relies on the physical exam primarily.
Got it. Similar signs, different frequency.
Exactly. Third, management. This is where it diverges dramatically. For camelids, we have standard surgical approaches, established protocols, often with a good outcome.
Right.
For cervids, surgery is basically a no-go in the wild. In farm settings, it's technically possible, but complex, expensive, difficult post-op care. So euthanasia is often chosen.
Big difference in approach.
Massive. And that leads to the fourth point, prognosis. Generally good prognosis for camelids if they get early surgery, especially type I or II. But for cervids, it's guarded in farmed animals, depending on specifics, and again, fatal in the wild.
That really crystallizes it. Understanding those nuances, prevalence, management feasibility, prognosis, it's not just academic, is it?
Not at all.
This knowledge is vital for veterinarians, for anyone involved in breeding or caring for these animals. It helps them recognize the types, make informed decisions, understand the stakes.
Especially when, as we said, time is absolutely critical.
Well, thanks for joining us on this deep dive into Atresia Ani. We hope you, listening, feel a bit more well-versed on this complex condition.
And maybe as a final thought to leave you with, consider the ethical and practical dilemmas this throws up for veterinary professionals. How do you balance the desire, the capability to treat an animal versus the realities of its life? A cherished alpaca versus a farmed elk versus a wild fawn. It really makes you think about how our understanding of basic anatomy, development, and the animal's context shapes these critical, sometimes life or death decisions.